Hi, and welcome to A Sense of Wellness podcast, inspiring and empowering a healthier you. I'm your host, Susan Greeley, and I'll be diving deeper into the 4 pillars of wellness: sleep, exercise, nutrition, and stress management. Today, my guest and I will be talking about the integration of self-care and neuroscience in the practice of lifestyle medicine for prevention and treatment of chronic health conditions caused by stress. I repeatedly say that stress can move mountains, and out of the 4 pillars, I find that it is the most important one to get a grip on because it impacts all other wellness pillars: our diet, our exercise, our sleep, and most importantly, stress alone can lead to mental and physical illness. My guest today is just as passionate as I am about helping people use lifestyle medicine for prevention and treatment of health problems, and she takes a holistic mind-body approach to health. I'm joined by Dr. Juna Bobby today, and she is the host of her own podcast, the Mind Body Space podcast. Dr. Bobby is a physician who is board certified in diagnostic radiology and lifestyle medicine. It's a unique combination. She is a returning guest faculty member and certified clinician for stress management and resiliency training and resilient youth program at the Benson Henry Institute for Mind-Body Medicine at Harvard Medical School in Boston. She is also a faculty member at the Juilliard School Pre-College Division in New York City, where she teaches the science of resilience for peak performance as an elective. And Juna's passion is combining neuroscience and evidence-based self-care tools to create science-backed digital courses for children grades K through 12. And she also uses those with parents and teachers alike so they can incorporate them also into their daily lives. And Juna also provides these courses for corporations in order to foster resilience in the workplace. Juna posts educational videos about sleep on her new YouTube channel, Fall Sleep Easy, and she hosts the Mind Body Space podcast, as I mentioned. She has launched wellness programs at NYU's Grossman School of Medicine, Columbia Law School, and has held workshops and given grand rounds at many organizations, including Canyon Ranch, Yale Radiology, the Mount Sinai Medical Center, and more. I'm really very happy to have Dr. Juna Bobby with me today, and we'll be talking more about self-care and using her mind-body space approach to create healthier lives for both children and adults. Juna, thank you very much for joining me today. I am so excited to get started with this conversation.
Hi, Susan. Thank you so much for having me on. I really appreciate this chance to talk to you.
It's important, as you and I were just chatting away for a while before recording, and we are at this pivotal time in history, honestly, with what children and adults are going through with all the stresses in life. So before we jump into that, we'll go into your background a little bit because you were a physician working on cancer screenings and diagnostic care in oncology, I believe, at a top practice in Manhattan. So when and why did you make this change to mind, body, and lifestyle medicine?
Yeah, so I was working with patients. Oddly enough, I'm a radiologist, but I actually had my own patients. We had a little boutique practice not little, but a boutique women's imaging practice on the Upper East Side. And I actually got to speak to every one of my patients every single day. So when they had their exam, I would talk to them immediately after. So it was very unique in that way. And most of the people who came to see us were at high risk, whether they personally had issues or a familial issue. And so they were very anxious, as you can imagine, as most women are, to just even go get a mammogram. They've even done studies on the level of anxiety that mammograms and calling someone back for a diagnostic mammogram can cause in women. So this patient population was especially anxious. It was, the Upper East Side of Manhattan. And plus they had these, the family history or personal history. So happily, most of the time people come in and they're okay, right? So I had all this time to talk to them, and I started talking to them about prevention because a lot of people feel so helpless when it comes to something like a genetic predisposition to cancer. And I was always interested in prevention, I would say, especially when I became a mom. So when I first had my babies, I researched everything to be able to prevent toxins in the home, toxins in the playground, everything. So I started to discuss some of these lifestyle changes that they could make to lower their chances of having breast cancer or endometrial or ovarian, but mainly breast cancer. And they would be very surprised to know that they could do things. For example, you can exercise, and exercise has been shown to be dose dependent in the way that it can lower the risk for breast cancer. That's very surprising to people. And then I was very unpopular because I would talk to them about drinking alcohol. We know that alcohol has a very specific relationship with breast cancer. So even the recommended amount, most people will say 1 drink a day is fine for a woman. That is not true. Even like 1 glass of wine a week could increase your chances. So there is no threshold dose. And even though everybody, even your doctor might tell you, you can have a drink a day, it is absolutely not true. So these kind of things, that one people were shocked and they weren't so happy about, but it was so great to be able to give them something, to give them agency, to have them be able to know that 50% or maybe even more is lifestyle. You know, as a nutritionist, I'm sure you know about genomics and what the food you eat can actually turn your genes on and off, for example, for inflammation, for cancers, etc. So most people walking around don't know that they can do all of these things to prevent the most common cancers like colon cancer, breast cancer. I mean, it's not 100% proof, but you can significantly lower your chances and then maybe even lower your chances of recurrence if you've had it already. Not to make it all about somebody and like their lifestyle. And I'm not trying to make people feel guilty about, this is like a whole nother topic, but you know, people might feel guilty like, oh, I'm not doing everything I can to prevent cancer. But honestly, we live in an environment that makes it so difficult to lead a healthy life, as everyone knows, as far as like processed food, getting enough sleep, getting enough exercise, all of those things. So not like blaming, but it's also about taking agency and knowing that you have the power to do something about it. So that was a long answer, but yes,
I love that answer.
That's what I started to, and then I started getting more and more excited about that. And I found the Benson Henry Institute for Mind Body Medicine at Harvard Medical School. And I met Peg Boehm, who is in charge of training there. And that was the end of my radiology because I was so excited about this field of mind body medicine. And I started training with them. And it was just something that I was very passionate about. And I completely changed tracks in 2013. And now I only teach resilience and mind-body medicine. And I became board certified in lifestyle medicine, which also incorporates a lot more focus on what you're eating, how you're sleeping, how you're exercising, and those things.
Mm-hmm. And that is why we're here empowering people, Juna. So I love that answer to the first question. And it's just so helpful. I didn't think of it in those terms too, of imparting guilt. And we don't mean to do that. Like, it doesn't even occur to me because it's really all about delivering the right information, helpful health information, giving people these tangible tools, right? That dose effective exercise doesn't cost anybody anything, but it becomes overwhelming, I think, for people on a daily basis. You and I are in the New York area, and right now we literally are engulfed in this terrible smoke from the fires, and things beyond our control do happen, and they will continue to happen. And so it's, life will always be about trying to juggle what's coming at us. There are these unpredictable factors, right? Stresses that come at us. And so even in those times, how do we navigate this healthy daily lifestyle and focus on what is within our power on a daily basis? I'm going on a little bit about that too. Let's talk about the specifics of it, of self-care and prevention, because it is so powerful. And it keeps coming back to that message in the podcast episodes that I do. And I know you and I are extremely passionate about this. Just a little history that we were talking about, since we both also trained in Boston while I was up there, and had mentioned to you that back in the early 90s, as a young dietetic intern at Teaching Hospital of Harvard as well, Brigham and Women, I was introduced to, not personally, but the work of Dr. Herbert Benson and Joan Borisenko. And I was so taken by that. And I wanted to go that path. And so in my heart, I had this passion for mind body healing. And somehow life takes you on a different journey. And yet I feel as if it's coming full circle now, just in this conversation to you, and in meditation that I do in my daily life. I didn't mention this to you, but I do daily meditation. And I was listening the other day, and this guided meditation mentioned Dr. Herbert Benson and the body check. Isn't that hilarious? Like the mind body check-in. just want to say that.
That's wonderful. I love it. I love that you're coming full circle, and you can definitely come to the CME course in the fall with me.
Oh.
So I'm a panelist on it also. So last year, and I think this coming fall. So you should definitely come.
Okay.
Not too late to train in it. But going back to what you were saying, I think you make such an important point. Like this whole envelope of smoke and smog, and I just ran outside. I can smell the wood burning. Mm-hmm. It's really out of a sci-fi movie. And honestly, this is our new reality. And so I want to go back to what you said about when we're really stressed and there's these new things coming at us, whether it's a forest fire, or natural disasters, or political issues, or
all of it at once.
Yeah. And the massive change that's happening with artificial intelligence, which I am a big fan of, but also obviously it's a huge change. And the definition of stress on a biological organism, which we are, is that there's change happening. So these massive changes are going to cause us stress, mental, physical, environmental stress. So I think the first thing is that we're not going to always react in the best way to stressors that come at us, especially when they're massive things out of our control, like the forest fires. Although they're kind of in human control, it's not in our individual control at this moment. So I think the first thing to realize is that we might fall off. And we might feel a little off or a lot off and go back to our old habits of coping. That's possible. That can happen. The key is to recognize that it's happening and then to use the tools, like you said, like taking a moment or talking to a friend or talking to a therapist or talking to anyone or taking action, maybe joining an environmental group or doing some political action to help with the climate change. Those kind of actions, those kinds of using our tools and then recovering from getting stressed and going back to our old patterns, because that's going to happen. Like our brains keep those habits there. And when we get super stressed, they're going to come out.
Right.
And
back.
Yeah. And I don't know if it's possible to completely eliminate 100% something that's ingrained in us. For example, I had a bag of potato chips the other day. When I saw the smoke, I got really stressed. I wanted these salty chips. And and it depends also, like we know a lot about the brain and trauma. So if you've had adverse childhood experiences, which I also have had, those kind of things live in your brain and you're not going to be this perfect person in all situations. So that's the first component, is to recognize that and then kind of understand yourself in that way, understand your brain and that it's not personal. You're not a failure. You're not good enough just because you went back to your old habits. That's the first part of getting to get up and do the things that are more helpful to you, more healthful choices. And I say that from experience.
From a lot of experience and your unique combination of the neuroscience with the self-care. And that's what I want to hear. I'm just so fascinated by this. Whatever you can pull out of the neuroscience background and share with listeners is so important, Juna, because we talk self-care all the time and lifestyle medicine. And I think that that's the easy side to this, to what you do in your work. And what's missing is that true understanding of how the human brain functions and how we are all wired. And once people understand why and how things work, it's easier, I believe, to then adopt the change or recognize the reactions and what I can do to counteract what is so deeply ingrained, right? To not just judge ourselves in those moments where we have a negative response or a negative coping skill rears its ugly head again, right? We're not perfect. It's an ongoing process. But really tying to that daily self-care is what I'm talking about. Is we say self-care and prevention, and they sound like really nice words, but I want to stress that there's a lot of science behind it. And that's where you come in.
Yeah, you said it so well. I mean, the reason that we haven't talked about the brain that much is because it's fairly new that we know all of these things about the brain now. We didn't know much about the functioning brain because obviously we couldn't see it in action, right? Because that would not be possible until we had the MRI machine, which was developed when I was a resident. The use of the MRI machine was significantly increased in hospital situations, but then it became very prominent in research, like neuropsychology research, where they can actually see the brain and the blood flow to the brain when somebody was doing something like, for example, you put somebody into an MRI machine, let them just have mind wandering, and then you see what parts of the brain are lighting up. So there's been a lot of advances on what the brain or what parts of the brain are actually involved when we have self-referential thoughts or when we're having negative thoughts or if we're focused or not. So my background goes back to when I was in college. I got an internship, luckily enough. And this is just, I guess I was kind of resilient in this sense. I just looked through the newspaper and looked for a lab job, and I found this NYU medical school. They had a new laboratory set up. It was called a magnetoencephalogram. And it's like the EEG, but not really. I don't want to get into too much science, but I'll just say, but basically our brains run electricity, which most people don't even realize. But yes, there's electrical currents. That's how our brain works. And when there's an electrical current, there's always a magnetic field that surrounds that electrical current. So we were measuring the magnetic field from surrounding that electrical current in the brain. So I would do fun things like put a little vibratory mechanism on someone's finger, and then I would map out where they were feeling it on the brain. So that's what I did. That was my research. I worked with Dr. Rodolfo Linas. He is one of the fathers of modern neuroscience. And I was so lucky to work with him for over a year in his lab. And then I continued to write papers with him through medical school. So that's where my neuroscience interest came. And I knew that the brain was such a mystery. Even now, we don't know that much about it, but we're learning at an incredible pace how the brain works. So now we have so much information on why we feel the way we do, how, and psychology comes into this too, because the field of cognitive behavioral psychology therapy, they understand that thoughts trigger emotions and emotions and thoughts trigger behavior and vice versa. And it goes in kind of like in that triangle. So once you understand how your thoughts affect your emotions and how all of this affects your behavior, and it goes in sort of a circle. And then you understand the brain component, that your thoughts are not personal, let's say. So your brain is formed during your childhood. You get a lot of input from your parents. You will also get input from your environment. You get input from your experiences, and all of these things and your personal tendencies can package all the things that come into your mind in a certain way. You could package it into a negative thing. You can package it into a positive experience. But we all know now that the brain likes to package it sort of in a negative way because it's a problem-solving mechanism. So our brains like to solve problems. So if you hear that saying that for 4 negative thoughts, you're going to have 1 positive thought, it's mainly because our brain is always trying to solve problems. So if you kind of start to understand how the brain works mechanistically, and I can't go into that fully here in our short podcast, but the anatomy of it, how it evolved, the mechanisms involved in it, you can become sort of separate from the processes of your brain, which psychologists like to call metacognition. And I know that meditation and Buddhists, they also talk about being able to see your own thoughts. Like the Tibetan word for meditation is gom. And that just means being familiar with your mind, knowing your mind. And if you look at all the great philosophers in history, they always say like the main point is to understand yourself, right? Understand how your brain is thinking and know yourself. So if you have this understanding that there's this biological brain and that it's not personal per se, right? And that it's a whole conglomeration of evolution, anatomy, physiology, your experiences, all the experiences, your unique experiences, your genetics, all of that combined. Then with that understanding, you can sort of step aside and practice stepping aside and watching yourself and understanding where that emotion is coming from, understanding why you overreacted or understanding why you're processing certain situations the way that you do. And then once you can do that, then you can coach yourself into, oh, well, you know what, that might not be reality just because I'm seeing it this way. Understanding that your brain is an organ of perception and not an organ of measurement. For example, our brain does not measure temperature to the exact degree. Our brain is feeling and interpreting what our nerve cells on our skin and all of that is feeding back into the brain. So our brain is stuck inside this very hard skull. And it's just taking all this information and processing it. And the processing part has to do a lot with your unique experiences, what you learned, how you learned to process the world, how you learned to see the world. So with this big understanding, which can very much be simplified if kids were taught about their brain and how it works and the evolution, because now we have so much knowledge about it, it could prevent so much suffering. So much suffering comes from personalization of things that happen to you, or feeling like you're not good enough, or having negative thoughts about yourself. All of these cycles can be really broken if you can teach these kids early enough. And of course, it's never too late.
It is never
too
late. Right.
Yeah.
Children and adults. Specifically to children, though, educating kids right now, you do incredible, tremendous, impactful work and develop programs. And you just were talking a lot about kind of what you incorporate into those lessons and those courses. But just to reiterate that it does need to start young, and why it's so important to teach kids about their brains and the nervous system. So, obviously it's one system, but you need to learn a lot about the brain, but then the nervous system, the sensory system, what we feel, what we perceive, and then our actions as a result. Where do you start teaching, and how young is too young to teach kids about that in a way that helps them cope with stress, to help them calm down, relax? There's so much anxiety and even depression in younger children these days. So what's a good starting point for that, Juna?
Well, I think we were talking before we even got on the podcast, but we both agree that moms, if they can start before they even get pregnant or during pregnancy, it's never, like I said, it's never too early and it's never too late. And that's not just me saying that, that's neuroscience. They know that our brains can change all the way till death. And of course, the brain is developing massively between age prenatally, and then 0 to 5, and then all those different stages of development from 5 all the way to the year 27. So emerging adults. But there's so much to know about the brain, and it's so interesting. And if a parent understands neural development, they can also have so much less misunderstandings of like the terrible twos, I won't say it, the effing fours, and the tween years and the teen years. I mean, if you understand what's happening developmentally, that can change the entire relationship between parent and child and the family dynamic.
Think of that.
It's very powerful.
That is very powerful. And
yeah,
as we were talking before recording about being parents ourselves, and me as a mom with 4 boys, it is not easy. And the gender differences, I want to talk a little bit about that as well. This is June, I have to mention, is Men's Health Month, and not just for men, but young boys and growing boys and young men deal with, as we know, anxiety, depression, stress, things very differently than girls. And I just wanted your take on it, since you work with both, of course. And I know you have a son and a daughter. You have the different genders in your own home. I just have a whole lot of that boy energy, and they struggle in our traditional school system. They really do. It's hard. And I do my best to try to support them, as many parents do. So I just wanted to kind of gauge from you, are there things that we can be focusing on, let's say individually as parents, but even community wise and as educators and in schools, like reaching out to, I know you do this, so I do want to hear like how and why it's so important to get your type of programs into schools specifically, and help boys versus girls in understanding the differences.
Yeah. Again, I think that we were speaking about this before. Yeah, so we were talking about this before, and we touched upon the fact that boys learn very differently than girls. And I think the traditional schooling system may not be the best for boys, especially in this era where so many boys have been diagnosed with ADHD, or now it's called ADD. And as parents, we probably know that everyone seems to have a little touch of distraction, especially with all the technology and stuff. They've gone through a lot of changes in the last few decades. And we know that education, the way it's set up, was for a different time when kids grew up to have jobs in a corporation or a factory or whatever it may be. And then they set on that path and was on that path pretty much for their lives. That's how the education system was set up. But now, as you know, there is rapid change in artificial intelligence, in the way we work, in the speed of information. For example, textbooks are literally out of date when they're published. And these kids have so much information at their fingertips. There's this statistic that says that they have more information at their fingertips now on their iPhone than presidents did in the 80s or 90s. I might not be exactly right about 80s or 90s, but you can check me on that. So these kids know everything that's going on in the world at their fingertips. They have access. They're the first generation that grew up digitally. They have a very different need. They also need to address the fact that adaptability is going to be one of the biggest factors for success in this time period because of so much change in the way we live, the way we do work. So that's not exactly being taught. And I think there's going to be a lot of change coming in the next 5 years, I think, in the sense that it's going to be personalized education. So AI is going to make that possible, where each kid will feel like they have their own tutor almost in a classroom. So in that way, AI is going to be amazing. So, if somebody's asking AI a question and there's 29 other kids in the room, AI can answer your questions in ways that they can understand. And there's no judgment. There's no frustration, with one teacher teaching a room of 30 kids, for example. So I think that's going to be an excellent change in our education system. So hopefully that will come into play. But answering your question as far as Men's Health Month, the program that I bring into school, for example, is about teaching how the brain develops and how the brain perceives and how different kids and different learning styles could be perceiving things. There are certain generalities that teachers can learn and also the kids can learn so that they can communicate better and be able to support the needs of boys better in school. And again, the girls also need a lot of help, as we saw with the recent CDC data. 2 out of 3 girls are depressed and anxious.
Wow.
1 out of 4 girls, they showed, may have had suicidal plans. In boys, they've shown an increase also, but I think it's probably underestimating the amount that it's affecting boys. And they showed, I think, a 30% increase, like 30% of boys are depressed and anxious. So there is a huge need for all of this information to get out there so that kids can understand their brains more, understand in a way that's not personalizing what's wrong with them or something, because shame has a lot to do with it. A lot of kids won't talk about how they're feeling because they feel like they might be the only one feeling this way. So once they understand that it's a human condition, the brain, the emotions, and the cognition, then it opens up a whole new world for them, a whole new way of being. And it's such a simple concept, but it has to be taught. And the CDC has also shown that even the tiniest interventions that are given in schools make a big difference.
I love that statement.
I hope I answered your question.
Yes, you did. You did. And it was pretty.
I kind of rambled a little.
No, it was fabulous. And it is a very broad question. And these are topics that we're talking about that we literally could talk for hours, as you and I both know.
Yeah. But let me just recap. All I'm going to say is
I think
if the teachers, as well as the students, understand the brain and how it functions, how their nervous system works, I think it would serve everyone involved.
Right.
That's all I mean to say.
No, that was a good summary too. It does come back to what I talk about in this podcast, that your simple daily habits do matter most. And if you can help individual children make small changes to their own personal lives at the same time where it's supported by their teachers and their parents. And so obviously it does take a village. I say obviously because it does. And I think we forget that, and children feel very isolated in their own thoughts typically, don't you think? And because
yes, absolutely. Because there's so much like shame involved, especially when you get into like middle school and stuff. I do think this generation right now, they're somewhat more open to talking about their emotions. Actually, I've noticed this about this generation. So that's kind of hopeful. I do think when you bring the brain into it, it's going to make it even more accessible for everyone to talk about without feeling shame and embarrassed or anything like that. And so I do think it takes a village, like you said. And so the programs, actually, I have the curriculum, which I teach the teachers to teach in their classroom. And then I also have the stress management component for the adults. So parents in their lives can take this digital course that comes along with the curriculum or separate from it. And the teachers also, I provide it to any of the teachers who partake in this program so that they can learn about their own feelings, because that generation also, it kind of skipped them. They did not grow up with neuroscience. They did not grow up with the cognitive behavioral therapy or anything like that. So I think it's really important that they get a little bit of that as well, so that they have a common language when they talk to their kids and students.
Of course, that benefits everybody. Okay, all that said, I need to ask you, what are your favorite or your go-to daily self-care practices?
I would say that the most important thing that I say to myself every single day is to step back from the emotions that I might be feeling, and then understand that even my emotions are habitual. So the way that I react to certain things might be just a habitual reaction. The way I'm thinking about something may be a habitual thought about a situation. So I constantly ask myself, well, is this true? Is this what's really happening? Is this an appropriate reaction? Is this an appropriate emotional reaction? Am I saying things to myself that might make it seem worse than it actually is? So if I look outside and I see brown smog and I see smoke and I feel my heart starting to beat faster and I feel kind of like, oh my gosh, this world is coming to an end. And then I say, I know there's a bit of truth to that, maybe, but we have no idea actually that it's coming to an end. Maybe AI will actually help us. I know a lot of experts are saying that it's going to help us with climate change. So I start to give myself facts about what's happening. So if I start feeling panicky, I say, California had this 2 summers ago and blue skies came again. So I really try to remind myself of facts because, you look out there and you're like, when is this going to end?
Right. It was very Armageddon-like. We all had that same feeling, and we were reaching for cookies and chocolate and chips and things. Isn't that interesting?
Yes.
It does, of course, connect with all these other pillars that I talk about. What you're choosing to eat under stress and in those moments, and then not exercising. I was laughing, Juna, because I pulled up sitting there engulfed in that in the office in New York City, and your lungs felt like they were burning. And I pull up a little, positive statement through whatever I follow online, of course. And it was about taking deep breaths and to reduce anxiety. And I joked yesterday, I said, actually taking deep breaths in what we're experiencing right now it's bringing about more anxiety. And so like whoever would have known that breath work at this moment where you can't even breathe normally would be anxiety invoking. So it's just,
I kept thinking that same thing about the breath, like take deep breaths. But then see, this is where this is where I question myself. Well, we do have N95 masks, so we can use that and that can help us. So I started calming myself down in that way, like the facts, right?
Yeah.
And then after I ate those potato chips and then I used acceptance, like, okay, well, there's this brown soot in the air. I have to accept that it's happening. There's no way I'm changing that right now. And then I also ate a bag of potato chips. I'm not changing that. It already happened. So then after that, then you can get through that. And then I had a big vegetable dinner. So, because I know that vegetables will be antioxidants for my body. And I focused on eating oranges because I know oranges will help my lungs.
Okay. So I had the same conversation in my home, even this morning for my youngest, who does have a lot of anxiety. I love that we're saying the same things in our homes. Okay. Enough of he wanted to have soda, and I don't even have soda typically for whatever reason. There was Sprite yesterday because it was exactly the same thing. It ended up being pizza and Sprite. And so this morning he wanted to reach for Sprite. I said, absolutely not. That was a one time. That will never. Everybody can hear it now. I don't let my children have soda for breakfast, God forbid, as a dietitian. So in any case, I said, you need to have some of these organic strawberries. They're loaded with antioxidants. They're high in vitamin C. I said, that's exactly what your lungs need. And we need to boost our nutrition right now during this time. We need added antioxidants in our diet. And so don't despair, but focus on the facts and the positives. We will have blue sky and be grateful for these fresh from the fields locally. We have a lot of organic local produce. Here we are in June in New Jersey, the Garden State. So I frame it as that in a very positive way of what we do need to be grateful for and what is at our disposal. So I had to share that too.
I love that. I love that.
Antioxidants.
But I do add that there is that acceptance component. I think that's really important because we don't know what's going to happen. This is a time of huge changes and we could be hopeful. Yes, absolutely. There's a lot of hope. But yeah, there's also the fact that there are a lot of things going on.
Yeah, that word acceptance came up 3 times yesterday in conversations I was having with people. They come to me and isn't that interesting? So it came up again. And I love helping
people.
It's
very powerful.
It is powerful with that exact.
Yeah. And it goes again back to neuroscience. Like our brain is always trying to solve the problem. So it's going to ask like, what can we do? What's happening? That's where anxiety comes from when you keep trying to solve something that can't be solved. Right. And then anxiety is good if it keeps you safe, because sometimes anxiety will help you solve something. And like, for example, if you're afraid of going on your bike and being hit by a car, you'll wear a helmet. So that's useful anxiety. But then there's that part where our brains tend to go on and on and on. And that's where acceptance can help stop that loop of unnecessary problem solving, where there's no answer, where there's no control. Yeah,
it's really spiraling into this dead end kind of. So I know we could go on for a long time about this. I do want to ask you, right? And we will. We have much work still to do, Juna, together and individually. And this is so important to reach as many people as possible with the self-care and prevention and lifestyle medicine backed by neuroscience. I love that. So in order to do that, yes. I do want you to provide with listeners a little bit of information about where and how to find these programs that you develop and are available for schools, organizations, companies. Where can people access that?
Sure. They can go to mindbodyspace.com and I'm sure you'll have the link. Yes. And mindbodyspace.com and all the information is there. You can go into schools or organizations, individuals. But if you can't find what you're looking for, you can also email info, INFO, at mindbodyspace.com. And you can also sign up for our newsletter and you'll be able to get the new things that are happening. And we're digitizing a lot of our courses so that we can reach people on scale and to make it more affordable and shareable.
Ooh, I love that. Affordable and shareable. Listen, scalable. Thank you. That's fantastic.
Oh, and please follow me on Instagram. It's mindbody_space. Just look up mindbodyspace and it has a little brain for the icon. And that's where you can find me too.
I do encourage everybody to do that, as I will too. Thank you, Juna. And then I always have one final question for guests, and that is, what is one thing you are grateful for today?
I'm grateful that I met you because I can't wait for more conversations with you. We have so much in common, and this has been an incredible discussion because we did talk a little bit before the podcast.
Yeah. And we discovered a lot that we have in common. That is really true. I'm completely grateful for the exact same thing. Thank you so much.
Especially for the hair tips that you shared with me.
I wanted to do that little giveaway as well or reveal to listeners. We had a great hair conversation. We'll leave it at that.
Yes.
Thank you, Juna.
Thank you so much for having me on. I really appreciate it.
And we will continue this discussion. It's such important work that you do. And again, I'm so grateful for having you. Thank you for being here and hope to have you back. So please stay safe and we will talk again soon. Thank you, Juna.
You too. Thanks.
Thank you for taking time to join me and listen to this episode. You can find more information and subscribe to the Sense of Wellness podcast on our website at ccphp.net/sens. This show is brought to you by Castle Connolly Private Health Partners, a concierge medicine organization that partners with and supports exceptional physicians to deliver an unrivaled experience of comprehensive, collaborative, and attentive care for a preventative approach on health and optimal well-being for members. Be sure to listen in next time to the Sense of Wellness podcast, and remember, simple daily habits matter most.